Okay, got instructions to start. So let me introduce myself. My name is Dr. Norman Blumenthal. I am the Director of Trauma, Bereavement, and Crisis Intervention for All Children's Home and Family Services. And I will be talking to you for about the next 40 minutes or so in terms of coping the current crisis from the perspective, from your particular perspective. Before I begin, I want to thank Mr. Jay Zachter for organizing this. Also want to acknowledge and thank the administration of OHIL who made it possible for me to be available to this group and to all other groups that have needed assistance. And as well to our technology people, to Ari and to everybody who made this work technologically. It's a very large group, so we're not going to have kind of verbal questions and answers, but you're invited to enter any kind of questions and answers in the chat. And as we go through the presentation or at the end, I will attempt to address them. I will also be providing everybody with an email address where they can contact me or members of the OHIL trauma team if there are particular issues that have to be discussed, or even if somebody needs a crisis intervention via Zoom or any of the remote devices. Let me start first by saying that many of you who are participating, who are providing nursing care, janitorial services, food preparation, and other supplies and essential provisions are really the unsung heroes of this crisis. We're all aware that you are taking some level of risk. I hope it's minimal, to make sure that as much as possible, those who cannot take care of themselves are being taken care of, and that that some of the least basic, most minimal parts of society and life are continuing. So I just want you to be aware that maybe the focus might be on our leaders and maybe on the medical teams that are attempting to tackle and reverse this disease, that we're well aware of the enormous contribution that all of you are making. And I hope that some of the things I say today will make that easier. I can't possibly address everybody's need. I can't really have a bullseye and address it precisely because everybody is unique. Everybody's personal situation is unique, and everybody's job is unique, and the challenges are unique. So what I hope I'll be able to do in the next, let's say 40 minutes or so, is address it as best I can in a general sense, and at the same time, at least touch upon matters that are relevant to you. If some things I say are not relevant or doesn't resonate with your situation, we're up to 94 participants and growing. It's impossible to be able to personally, but exactly tailor to everybody's situation. And part of the reason is, besides everybody's situation is unique, the more extreme a circumstance, we're going to come back to this theme, the more individual we become. And the more we rely on true and proven ways of coping. So this becomes a very individual experience, which of course we're trying to address in a group setting. What I'm going to do is enumerate what are the common challenges and issues that people are bringing up, and then spend most of the time talking about different ways in which people are coping, have coped, or what we know from psychological research and study seems to work and help people get through challenging times like the times that we're going through right now. Obviously, one of the most pressing issues right now is anxiety, and the anxiety that everybody feels, and how to manage that. Now, anxiety is a tricky business. Let me give you an example. There are some habits or states that, let's say more like habits, that you can really totally remove, or should totally remove if you can. Overeating, smoking, substance abuse, these kind of gambling, these kind of habits, which we're going to get to later also, which might rear their ugly heads. I mean, ultimately the treatment is, if you know anybody who's been through those kind of situations, is to get rid of it. I mean, the best thing would be for a smoker to totally stop smoking. Best thing for let's say a gambler would be to totally stop gambling. But then there's some bad habits that you can't cut out completely. Like I mentioned, I alluded to overeating. We can't stop eating. You have to go from overeating to learning how to eat responsibly or have a modicum of eating. People might have a spending addiction. They might overspend. Now, you can't go through life without spending money, but you have to learn how to spend responsibly. Anxiety is a similar type of state. we cannot say to people to get rid of anxiety, because anxiety is necessary. Anxiety is what motivates us. And it is because of anxiety that we're taking necessary precautionary measures and we're exercising proper types of hygiene to curtail the spread of this illness or to prevent ourselves from being afflicted with it. So it's good to be anxious. The problem is if you have too much anxiety, or for that matter, too little anxiety. If you have too little anxiety, you're going to be dismissive. You're not going to care, and you're going to take chances and risks. As unfortunately, we've seen some people have, and those kind of people need more anxiety. But if you have too much anxiety and you start panicking, then you're not. First of all, it's not good for you in general. It's not good for your emotional state, not good for your physical state. But then you're not going to be acting rationally. So all of us who are in the throes of this crisis have to learn how to achieve a medium level, a modicum of anxiety. Now, in terms of anxiety, a lot of what we're going to find in a situation like this, and again, this is a theme we're going to be coming back to, is that whatever you were before this happened is now going to escalate, is now going to be higher. So if your nature was to be sort of dismissive, if your nature was to be not cautious, maybe to be a little bit too much of a risk taker, let's say, then you're going to be all the more so now. If your tendency was to be anxious, if you had an actual anxiety disorder, or if you were prone to anxiety, then of course your anxiety will be too much. So a very important part of coping with this is first of all to know yourself and to know, do you need more soothing, calming kind of interventions, or do you need to be mobilized more? Do you need to be more aware? And we're going to address both of those. Now, if you're not sure, and it can happen that you don't really know yourself, we're not very good judges of ourselves. A very good way of finding out is to talk to people who know us, is to talk to a partner, to talk to a spouse, to talk to family members, to talk to friends, and get a sense of, to what extent are you prone to anxiety, are you prone to too little anxiety, but to know that you have to try to find and reach that medium level, and that's hard. Because, as I said, extremes are easy. It's always hard to achieve that medium level. Now, there's other factors that can interfere with our achieving this sort of appropriate level of anxiety and concern. One of them is our information sources. The way in which we get information, whether it's news or medical information, has changed radically in recent years. It used to be there was a very contained source of information, whether the newspapers that we read, maybe the news shows on TV. Today, with the proliferation and the advent of internet and social media, there is a plethora, there's a huge amount of sources of information, some who will acknowledge a bias, some who may not acknowledge a bias, but have a bias. And this has several effects. Number one, they're competing for our attention. So there's hundreds, if not thousands, of sources of information, of news outlets that are competing for our attention. And the way they get our attention sometimes is by from some very sensationalist types of headlines, by quote unquote breaking news, which may not be verified yet. So we're getting bombarded by information. Some of it is blatantly inaccurate or incorrect, and that's been proven. And some of it may be premature. It might be a hunch, and that's being now publicized. So that in and of itself can either, again, create too much anxiety, or we can get so overwhelmed that we just keep ourselves uninformed. The other thing that can happen is just the sheer volume of information, just that there's so much available. That alone can cause us to either become overly anxious or to just sort of feel like we're drowning and not look at anything. So I'm going to talk a little bit later on that we have to learn how to, in a crisis like this and in today's world, we have to learn how to use this news media so that it's constructive. And it's a wonderful development of that we can get so much information in so quickly, but how we can sort of gain mastery over that. Another issue is that in today's modern world, we're not used to being vulnerable. The remarkable, incredible accomplishments and developments that we've had in recent years, not the least of which is the internet and the computer, et cetera, is we're used to very quick, complete solutions to many problems. There are many illnesses that were devastating in the past that today are eminently treatable. I mean, it wasn't even so long ago that an infection could be deadly, and today we have antibiotics. Even cancer, although we have a long way to go, there are many types of cancer so to that we can treat, and therefore we're used to feeling that we're just invincible, and that modern science can address everything. And many of us are finding this current crisis and this current illness very humbling, and something that we're not used to. That we're so helpless that we have to all sort of distance ourselves and some quarantine ourselves while our leadership and while the scientific world tries to figure out how to handle it. So this is something new and difficult for some of us to handle. Another piece that's very difficult, and I will address it, but I just want to put it out there, is the ambiguity. We just don't know what's going to be. We don't know how long this is going to last. We don't know how deadly it's going to be, or what are going to be the consequences, what's going to be with the economy. Are we ever going to get back to normal? And I'll talk about that in a little bit, but you have to understand. And by the way, that's part of the problem with the news and information I mentioned earlier, because being an ambiguous state is very anxiety producing. We like certainty, so much so that it's an interesting observation, and some of you may be aware of this, that I don't know if you know people who may have, let's say, had cancer and were waiting for test results to see if it had spread to lymph nodes or other areas of concern. And they're waiting a week for those test results. And even if the test results, God forbid, come back and they're bad news, many people will say that's less anxiety producing than that week of uncertainty. So ambiguity itself produces a lot of vulnerability. And again, I get back to what I mentioned earlier in terms of the information that we're bombarded with, because we don't like being in an ambiguous state. So a report of questionable validity or something or that's being prematurely disseminated, will jump on it because we want certainty. So we have to be aware that there is an element of ambiguity. We're not quite sure how this is going to play out. Hopefully it'll play out well and soon, but we don't know for sure. And that makes it also all the more anxiety producing. The other thing that's important is that it's also the evolution of this illness has been different than other kind of traumas that we've had to deal with recently. I can speak in terms of the trauma team at Oval. We were very involved with Hurricane Sandy. We were involved with the fires on the West Coast, with flooding in the Midwest. These were sudden cataclysmic events that happened, and then we can spend time picking up the pieces and trying to figure out how we're going to emerge from it and maybe prevent a recurrence. Here, it sort of crept up on us. It happened in a slow, sort of insidious way, and the cause is something we can't even look at. I mean, we see all those images online of what the coronavirus looks like, but we really don't see it, and we don't know it. So that also is relatively new and increases our anxiety. And then, of course, the obvious for those of you who are going to work and working in health facilities or doing cleanup, etc., or processing food, is who else you're around, what you're touching, and your element of risk. So let me talk about many of the things that we can do that can at least mitigate or lessen the anxiety or the concern. Okay, first of all, as I mentioned earlier, you have to know yourself. You have to put a mirror in front of you and not only look at your physical features, but we have to put a mirror in front of ourselves and understand ourselves psychologically. Who are you? What has worked for you in the past? And what are your vulnerabilities? So again, as I mentioned earlier, are you prone to anxiety? Are you prone to obsessive compulsive disorders, to excessive cleaning or concern about germs? Or are you too calm? Are you too dismissive? Do you put your head in the sand, as the old proverb goes? And therefore, you need to, by understanding yourself, you'll need to know what you need to do. Do you need to alarm yourself? Do you need to become more alarmed? Do you need to engage in more calming behaviors? The other thing you have to do in terms of knowing yourself is to be realizing that whatever troubled you before this crisis came is probably going to trouble you all the more so. Not everything, but probably many things. So for example, if there was a coworker with whom you don't get along, if there was a boss that was you felt maybe was too harsh or didn't appreciate your job or whatever, but before this happened, it was annoying but manageable. In the throes of this crisis, when you're already feeling tense and you're feeling threatened, it's going to bother you all the more. So be aware that what had pre-existed, what had been concerns previously, are going to escalate. Similarly, if you are to varying degrees quarantined or staying home more, then relationships within the home that may have had, I'm not saying necessarily even there were bad or abusive, but aspects of them that may have troubled you are going to trouble you all the more when you're on top of each other on a constant basis, whether it's a spouse, a partner, it could be a roommate, it could be children, it could be parents. Whatever it was, it's gonna aggravate you more when you're tense. The way tension works is that when you're distressed about something, if something else is going on, everything else hurts more. It's a little bit like the old expression, standing on someone's ingrown toenail. When something else hurts and then something else is going on, it escalates all the pains. Just like when things are good, then everything seems pleasant as well. So be aware that there are issues that are going to be coming up, or there are relationships or personal tendencies. It doesn't even have to be in the area of anxiety. If you're struggling with depression, then depression can get worse. If you're struggling with impulsivity, then the impulsivity is going to get worse. So whatever it is, it's going to get escalated in a crisis situation like this. Similarly, whatever has been your coping mechanism will be the one that you're going to rely on and you're going to need all the more. In fact, that's one of the reasons, as I mentioned earlier, why we get very individual in situations like this. Sometimes I give as a sort of a metaphor, as a parable. Imagine someone's a carpenter and he's building a tool shed. So he can experiment with new material, with new types of ways of doing construction. However, if he's building an extension on his house, or if he's building a bedroom for one of his children, he's going to use the methods and the material that he has known in the past has worked well for him. We're no different as human beings. If we're in a nominal problem, a minor problem, we can try different ways of coping or managing it. If we're in a highly threatening situation, we're going to turn to what works for us. Now, there might be things that work for us or that we have used as a way of coping in the past that are very constructive. And I'll just name a few. I mean, how we cope with anxiety, that we might have various types of outlets. So it could be that it's exercise, it could be reading, it could be art, it could be music, it could be yoga. These are all constructive ways of coping with stress, and the internet abounds with many recommendations, even for those who rely on exercise, as many of us do today. And of course, organized sports and health clubs are not available to us, but there's much that you can do via the internet at home. And if that works for you, those are certainly not going to, unless you do it excessively, it's not going to do you harm. And it's a very constructive way of coping with anxiety and distress. But some of us may have, and we're all human beings, some of us may actually have ways of coping that are not constructive. We might have histories of alcoholism or substance abuse or overeating or smoking or other kinds of addictions or habits that are not healthy and not good, which we've conquered and we've mastered. But now that we're in stress, it's very easy to revert back to them. So we have to be very careful about the types of coping mechanisms that we may have had that were harmful, because they're much more likely to recur, but to, in a healthy way, rely on and mobilize those types of constructive types of coping and outlets that make matters easier. Let me just say very quickly, in terms of just one other one that comes up a lot, is what about movies or video games? And that's a little bit of a mixed blessing. There's no question about it that it's a welcome opportunity to get away from the current stressors. And it's a welcome opportunity, sort of a healthy types of escapism, to watch a good movie. You just have to be careful that, or for that matter, a show, you have to be careful that those kinds of activities are so consuming that while you're doing them, you really feel like you're away. But sometimes the emotional response happens right afterwards. So if you're upset about what's going on, if you're going to watch a very sad movie, you may not feel sad while you're watching the movie, but afterwards, the sadness of what's happening now and the sadness of the movie can have a cumulative effect. So it's important that, or even video games, some of these very fast-paced and intensive games that get us very worked up, we won't feel it while we're on it, but afterwards we can find ourselves even more tense. So be sure to pick, if you're using that as outlets, movies or video games, etc., ones that don't have such an impact that could be you could feel afterwards that would be harmful. And if you're not sure, and again, rely on others. Talk to people, other people. We learn about ourselves from our interactions with others. So sometimes if we're not too sure whether what we're doing is constructive, whether what we've done in the past will be helpful, bounce it off of the people who know you, and they'll do the same with you. And in general, by the way, it's very good if you're feeling stressed, if you're feeling pressure, to talk it out with others. Now, sometimes talking it out with others is misunderstood to mean, well, the other person's going to give you some healthy advice, is going to tell you what to do, which sometimes they may. But interestingly enough, the mere act of talking about something that troubles you, and there's a ton of data in psychology proving that just speaking about how stressed you feel about the pressure of your job with what's going on, the pressure of trying to remain safe while having to do your job, the pressure of being confined to the home, the fears of contracting the illness and what impact it'll have on you, or how virulent it'll be. All these things, if you just talk to someone and the person, if you're the listening person, you just listen, or if the other person just listens, you already feel better. So it's a healthy outlet to just share and discuss and put the emotions into words. Now, in terms of the information, this is maybe this is a silver lining of the crisis, but this is an opportunity for us to learn how to process information and how to use this relatively new medium. It may seem like it's been here forever, but it's still relatively medium, and how to get information and not be overloaded by information, and to filter the information and know what's accurate and what's not accurate. You may have to pick certain sites or certain sources that you know are reliable and use those for your information. You may, if you want to read more openly what's coming your way, just learn to use the proverbial grain of salt and understand that not everything is always exactly the way it's presented, and also to contain it, not to allow yourself to be, especially if it pops up on your screen and that's the way it works. And it's, and sometimes very often they're programmed, they know your interests and they know how to get to you, is to, the basic bottom line is have mastery over it. We have to use the internet. We have to use this source of information constructively, not let it take over our lives. So that's another way in which you can manage and get that happy medium of concern, but not crippling anxiety. Now, in terms of the ambiguity, I have two thoughts to share with you. And again, not everything I say is going to be 100% applicable to everybody, but I'm offering it out to you as a menu to see if it's useful. I think the two things we can look at it. First of all, we don't know what kind of course we're in. I've seen everything online, from months to years to weeks. It's very hard because this is all very new, and even the big experts are not quite sure themselves. But we can know historically that most crises of this sort, whether they are plagues or whether there are other economic setbacks, they have a beginning and middle and an end. Life has a cyclical nature. And I'm not minimizing at all the hardship that one goes through when they're in the middle of it, or the shock when we're in the beginning. But I think for us to think that this is going to be forever, that this is going to be for as long as we live, as long as we're around, probably isn't correct. So even though we don't know the timetable and we don't know the fallout from this crisis, I think we can safely assume that it will be resolved, or it will get better. And I think we can hold on to that. If you're not comfortable with that, there's a way to surrender. You surrender to the helplessness and to our limitations. And maybe, again, that could be one of those teachable moments, one of those lessons we can get from this, is that we're not totally in control, that even despite all the advances we've made with technology and medicine and science, that we are still, in many respects, hapless, and that's okay. It's okay to surrender to the fact that we have to deal with what we don't know, and we have to deal with still areas of vulnerability. I remember once, and this was very meaningful to me, I once happened to be touring a substance abuse program, and there was a general from the Army there. And I found him actually much more interesting than the program. But one of the things he said to me has stayed with me. And he said that we look at generals in the Army as, we look at them or we worship them because of their victories, of their military successes. But a good general also knows when to retreat. And a good general knows when to give up and to cut his losses. In fact, I once heard on a podcast about the American Revolution that was General Washington's strength. He was very good at retreating, and he retreated from Brooklyn, he retreated from New York, he retreated from parts of Jersey until it was time to turn things around. And we also, if we're going to be generals of our lives and we're going to be in charge of our lives, we have to know sometimes when to retreat, when to give up, and when to admit to the fact that we don't have answers to everything, or even the people that we've traditionally relied on don't necessarily have answers. I want to also speak to how important it is to preserve your routine. That, there is something very comforting with regularity. Regularity sort of, first of all, structures us, and it also reminds us that life goes on. So it's as much as you can try to preserve your routine, whether it's what you do, getting up on time, getting dressed the way you had gotten dressed, whatever your day was, going to bed at a certain time, contacting people at the people you always contacted, doing the recreational activities to the extent that you can, as much as you had in the past. But whenever our lives are as disrupted as they are now, the extent to which we can preserve our routine will be comforting. Another thing is also, by the way, is we may have to set up priorities. One of the questions that we've gotten asked a lot about are people who have issues, whether they're issues personally, such as psychological issues, or if they're relationship issues or financial issues, and even some health issues that are not necessarily life and death. When we're busy with this crisis and when the world is so consumed with this crisis, we have to park them. And many people have even suggested that. I've said, listen, just manage it for now, because we're in a crisis mode, and during a crisis, we don't have the energy or the resources to address these things. We'll deal with it when it's over, and hopefully be over soon. So you may also have to sort of do a sort of inventory of your life and what stresses exist and what pressures exist, and which of them can really be filed away for now, and you'll get back to them later. It's important to remind yourselves of how noble and heroic your work is. As I mentioned earlier, many of you online today are the people that are keeping life going now, and it's not, one of the terrible things we do is take things for granted, whether it's other people taking it for granted or whether you take it for granted yourself. And when you're feeling stressed and you're feeling threatened and you're facing possible deprivation and hardship, it's good to sort of recognize your nobility and the nobility of people around you, that there are many people or many individuals who are engaging in highly charitable acts and in altruistic acts, and are, how impressive and we can be as a people. And we need to access that. Maybe we should access it all the time, but we need to access that, especially when we're going through the kind of hardships that we're going through now. Another risk that I do want to address is not getting so acclimated to this new reality, to this new normal, that you get careless. I mentioned before that one of the risks when we talk about anxiety is having too little anxiety. And I think most of us are probably right now experiencing heightened anxiety, but if this lingers on and whatever has, become the precautionary measures, et cetera, become normal, we can get lackadaisical, we can get lazy. And especially for those of you for whom lapses in judgment can have serious health consequences, you have to maintain your alertness, because make sure for your well-being, for the well-being of other people as well, not to sort of get too used to this new situation, so that you don't have some of the alert and the alarm that you should have. An interesting thing, response that many people have found helpful is to focus on gratitude. There's a remarkable body of literature and psychology of how important gratitude is, and that people openly express, not just feel it, but openly express gratitude, have less depression, less anxiety, they sleep better, they're healthier. In fact, people who keep like gratitude journals, who regularly write down aspects of their life that they're grateful for, have more serotonin and dopamine secreted in their central nervous system, meaning that it's actually a natural antidepressant and tranquilizer. And especially now, as so many of us are feeling deprived and confined and separated from what had been our routine or parts of our lives that we've enjoyed and found fulfilling, we have to very deliberately be grateful for what we still do have. And so if we're removed or disconnected from friends, we have to be grateful that we have friends. And as we are home with our partners or with children, and even though that might be hard being cooped up, we have to be grateful for those people in our lives that enrich our lives. And even when we have to stay cooped up in our house, we can be grateful for our house. But identifying parts of your life that you're grateful for is generally very healthy and helpful in terms of coping, but especially when we're deprived and especially when we're pressured. It becomes all the more important, and it's something you can't just say, oh yeah, of course I'm grateful, and just think about something else. You really have to sort of write it down, think it out, say it out, and it'll help enormously. One of the things I found very interesting and almost encouraging during this crisis is some of the humor and some of the memes, cartoons, the blogs, some of the things people have posted that are really very clever and funny. Now, humor is a slippery slope. Humor is tricky. There's a strong body of literature that shows that humor is a very important part of coping with trauma and crisis. Humor does two things. First of all, the laughter and the joviality that comes with humor takes away some of the pain. The other thing is also, if you dissect the joke, your typical joke is that you lead somebody a certain way, and then comes the punchline, which kind of redirects the person. That's what we seem to find amusing. And that's really captures some of these traumatic crisis events. Life was totally normal. Life was fine. We were doing our thing. And then suddenly, seemingly out of no place, comes this illness that is just turning the world upside down. There is an element of it that is, if you'll pardon the expression, amusing, funny, or just the sheer preposterousness of it is being expressed. And therefore, I think it's bringing out the best in people. The only thing you have to be careful, and that's why I said it's a slippery slope. Jokes are good, but not at the expense of someone else, not trivializing somebody else's pain, and not, or for that matter, not at the expense of any subgroup or persecuted subset of our population, because then it can be actually in bad taste and hurtful. So we should use humor. We should, in a way, laugh about how outlandish all this, but be careful that we do it in such a fashion that it's not causing anybody any pain. One or two more things, and then I'll conclude. If there are questions, I'm happy to field them. But if not, I'll tell you how to get questions to me. There's something that we refer to in psychology as the psychospiritual. Now, this is basically spirituality, religious observance, etc. And there is a body of literature that shows that the capacity to engage in spiritual outlooks or religious practices can be helpful in difficult situations like this. Now, this is a very personal thing. Nobody can dictate to someone. It largely depends on your culture, your background, what you've been taught, or what is meaningful to you. But really, what is the basis of the spiritual or even religion is that it takes you away a little bit from your surroundings. It takes you away from the world you're in and makes you look at the larger picture, at a picture that's beyond the hardships of this world. Or it could be even a belief that there is some greater good by some superior being that we can't fathom at this point. Now, it's not for everybody, and some people don't have that background. For some people, that's not meaningful, like everything else that we're talking about. But if that works for you, and if that is part of your culture or belief system, it's certainly something that may be helpful to rely on it right now. And then a related type of way of coping is something we call meaning making. Meaning making means, or post-traumatic growth, that we try to extract from the hardships and from the difficulties, life lessons, something that we can grow from. And again, it's not that we're happy that this is happening, and not that we're saying, oh, it's wonderful that we're experiencing such threats and such confinement and setbacks in the life that we've had, but it chips away from it a little bit. It doesn't make it all bad. It takes away from some of this appearance of senselessness and purposelessness that such crisis and hardship has. So again, if you can, like I mentioned, one of the things I think might be a teachable moment from this is how we're going to use information, how we're going to process information, or for that matter, greater appreciation for what we do have and what has made it possible. I think we can be grateful. I mentioned gratitude before, that we have the technology today, that we have the capacity through the internet to be able to connect and relate as we are doing right now. So again, that's a very individual thing. Nobody can tell you. And what might work for one person may not work for the other. So these are very personal, but in a global sense, if we can extract from it, if we can extract an appreciation, maybe some of us who are trying to homeschool our children will now have a greater appreciation for school teachers and what they have to do. So again, it's a method and in a way to make this more manageable. And if it makes sense to you, if it works for you, please don't hesitate to use it. Last but not least, as I said, there's something particularly insidious about this crisis we're going through, and that's that it crept up on us. And these kind of crises that creep up on us, sometimes you have the proverbial straw that broke the camel's back. It's not one big event. I mean, if you were affected by Hurricane Sandy, or if you were affected by the fires or the flooding in the Midwest, it happened. It was a very sudden event. And therefore, it's very clear that this one big, huge event had caused the crisis for you as stress. But this type of thing is something that sort of in small incremental amounts catches up with you. And after many days of either being confined to your home, or over many days of having to be so alert in terms of safety, or having to wear equipment that is uncomfortable, or have to be constantly in such a vigilant state, it may not be the one time it happened. It might be the 20th day, the 25th day, and then it just reaches a breaking point. And that can happen to any of us. So we have to be very self-aware, and we have to reach out if we need help. And reaching out, obviously, if it's manageable, can be to friends, and can be to clergy, and can be to bosses if they're wise people that we trust. But it can also, if necessary, be to mental health professionals. And fortunately, again, these kind of situations bring out the best in us. And there are many resources that are available, again, mentioned online. I will just share with you that OHEL, our organization, will make ourselves available. The crisis team will make itself available. We have designated an email address where you can ask for either a session with a crisis, for crisis management, or you can ask a question that we can respond by email. The email address is copingwithcovid19 at ohelfamily.org. That's copingwithcovid19 at ohelfamily.org. I hope that what I've said has been helpful. I'm going to look and see if there were questions submitted. I don't see on my computer that there were any questions submitted, unless I'm not looking in the right place, but it looks like there weren't. So again, I welcome anybody who has more particular issues or concerns. Please feel free to do so by writing to Coping with COVID-19 at ohelfamily.org. That's Coping with COVID-19 at ohelfamily.org. I'm just looking to see here as I see something. Is somebody raise a question? I don't.
I want to jump in, Dr. Blumenthal.
Yeah. Okay.
Hi, Dr. Blumenthal. First of all, thank you so much. This is Jay's actor at Ploy, and we appreciate you taking the time. I know personally you're extremely, extremely busy. It means a lot to us to take some time of your day to address our industry, the concerns that we have, the people that we deal with on a day-to-day basis. These are really trying times, crazy times, and we're all trying to hang in, and for ourselves or just for each other. We will distribute the Coping with COVID-19 at ohelfamily.org email to everyone. Please feel free to ask any questions, any follow-up concerns, or issues that any individual have. We at Ploy, we're here to really to assist you. We want to do whatever we can, if possible, to help and to assist in these really trying times. Available if you need to offer any help, any assistance, any advice. And we will try as much as possible to get the resources, things that you might need in order to make a very, very trying situation that much a little more manageable. Again, we will distribute the email, Dr. Blumenthal's email for questions, and everybody should feel Dr. Blumenthal either through us or directly with him, anything that they think could be helpful, any guidance or resources they want to be steered to.
Okay, again, I thank everybody who organized it, and I hope this was helpful.
Thank you very, very much, Dr. Blumenthal. Everybody have a great day. Keep well and keep safe.